Everyone. My name is Councilor Chris Moyes, and thank you for being here today. Welcome to TC Talks. We started this series last year. It went very well. And in 2025, this is our second session. The one we had last month was on noise, and it was well received. And so this month, it's on mental health and addiction. A subject that's very close to my heart. For 22 years, I worked at St. Michael's Hospital, focusing on addictions and mental health. So, and of course, being chair of public health, I'm inundated with this subject matter each and every day. And being the local council for Toronto Centre is something that's also very prominent here in the ward as well. 62% of social services actually is right here in Toronto Centre. And we have many SCS sites here as well. And a few of them are, when I say SCS, supervised consultant sites. Many of them are actually closing right here in the ward as well. But before I go any further, I would like to acknowledge that we are gathered today on sacred land, territories of the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, and the Wendat peoples, and Chippewa peoples. Toronto today is home to many diverse peoples, including Africans who were trafficked during the Atlantic slave trade and their descendants. This land is subject to the District 1 Spoon-Wumpan Belt, which compels everyone to stewardship of the land. We must recognize that we all need to eat and live off the abundance of the land equally, and we recognize the same reality for our future generations. Without intentionality and care, we cannot honor these responsibilities and pay respects to the Indigenous elders and ancestors to show that we understand that we are all treaty people. And so the agenda for this evening, we have 7 points here. We're going to start off with a few presentations from the Community Safety and Wellbeing Unit, from Social Development and Finance Administration, SDFA, as we call it, in-house, followed by Toronto Public Health, then the Gerstein Crisis Center, and finally, the WANASA. Our panelists will provide some context from a policy lens, a public health lens, crisis response lens, and an advocacy lens. Then we will break out into panel discussions between our panelists. Feel free to chat among yourselves and ask yourself questions, ask me questions. And finally, we'll facilitate questions period, and then we'll wrap up for the evening. I just would like to go over the code of conduct. We try to do that each and every time when we meet in person. This is a safe and inclusive space. Everyone must be treated with respect and dignity. Discrimination or harassment of any form, whether verbal or physical, would not be tolerated. We believe in fostering an atmosphere that encourages open dialogue and productive conversation. Comments should be productive, respectful, and related to the discussion at hand. Everyone has the right to privacy. Those who do not wish to be photographed, videotaped, or recorded should request a sticker from the registration table at the back of the room. Attendees taking photos, videos, or recordings must obtain the consent of the subject of the photos, videos, or recordings. And by following this code of conduct, we can have a productive meeting. So we'll get right into it. Mohammed Sharia is the Director of Community Safety and Wellbeing of the Social Development Finance Administration Division. And so I will ask him to start off with his presentation. Good.
Hello, everyone. Thank you so much, Councillor Moyes, for having me here and for organizing this talk. So I'm going to talk to you today a little bit about the city's community safety wellbeing plan, and what the plan entails and the efforts around community safety. I'll also talk to you specifically about some of the mental health supports the city has in place. And then I'll talk a little bit about our Downtown East Action Plan and some of the initiatives that are under our Downtown East Action Plan. So the next slide is around what is SafeTO. The provincial government has mandated municipalities to have a comprehensive community safety wellbeing plan. That plan must be adopted by each municipality in Ontario. The City of Toronto's 10-year Community Safety Wellbeing Plan is called SafeTO. This was adopted in 2021. The goal behind SafeTO is to shift the conversation of community safety from being focused primarily on enforcement to having a broader conversation around what are the various roles multi-sectoral partners can play to help create well-being and to address community safety issues. So it's a roadmap that engages all our community partners like community services, businesses, healthcare, education, justice systems, and how we can collaborate to bring about community safety. It was adopted by the city as well as the Toronto Police Services Board, the Toronto Community Housing Corporation, and the Toronto Public Library. I'll talk a little bit about what does the plan entail. The next slide. There are 26 actions that cover SafeTO in 7 key strategic areas, and I'll quickly run through them. One is around reducing vulnerability. This is addressing harm and victimization through responses and proactive solutions. And I'll talk a little bit about one of those responses being the Toronto Community Crisis Service. And we have one of our key community partners who leads that in Susan Davis at the Gerstein Crisis Center. Another key bucket of work is around reducing violence. Unfortunately, we've seen significant issues around gun violence in our city. So efforts to help dedicate to prevent, but also respond to gun violence in our city. A third bucket is around advancing truth and reconciliation, recognizing the rights of Indigenous communities, but also the challenges faced by some of the social determinants of health, in particular by the Indigenous communities, and how do we help engage, but allow Indigenous communities to lead on solutions that serve them best. The fourth bucket is around promoting healing and justice, and how do we help build a more trauma-informed city. And the last few buckets, one is around investing in people, building up the capacity of our neighborhoods, and driving collaboration and accountability. So the key strategic actions around our SafeTO is in these 7 buckets. So what does the plan hope to get done concretely, and what was done in the first phase? So one major action was building out a comprehensive crisis service that's well-resourced. And so action 1.3 is around the Toronto Community Crisis Service. And you'll hear me talk about this several times in this presentation. This really came about from conversations that were happening in early 2020, around June after the murder of George Floyd. City Council passed a package of police and reform directives. One of them was to build out an alternative community safety model and to engage community partners to build out that model. And we were able to build out and pilot the Toronto Community Crisis Service, which is a 24/7 mental health response service available to anybody in the city of Toronto by calling 211 or 911. And I'll talk a little bit more about that in a second. The second big bucket of work is Action 2.3. The city has community development officers, which are frontline staff that respond after an incident of violence in communities. Oftentimes they work with communities to provide healing, to provide mental health supports, provide safety strategies and building out safety responses. And so part of the work was to ensure that this can expand from being a 5 days a week model to a 7 days a week model. And I'm happy to say we were able to increase the capacity. The Community Crisis Response Program responded to about almost 2,000 incidents in 2024 and provided support to close to 9,000 residents across our city with mental health supports since 2022. Action 2.1 is around reducing gun violence. And so we were able to build out a multi-sectoral office that engages our Toronto Community Housing, Toronto Police Services, our businesses, our TTC partners, through the Toronto Office to Prevent Violence. The benefit of creating this office is we're able to do real-time data sharing and coordination around responses and incidents in communities. And last but not least, I mentioned data, but 7.1 talks about the building of a comprehensive strategy to share, integrate, and analyze data across multiple institutions. So we're able to build out what we call the SafeTO Collaborative Analytic and Learning Environment. SCALE is the nickname. We like our acronyms at City Hall. Forgive me for that. But the purpose behind this is to have a centralized point where we can understand different data and different situations from one point, and we're not trying to all get the data at after the incident happens. So I'll go a little bit deeper on the Toronto Community Crisis Service, and I imagine Susan will also. So I'll try and not go too deep on this, but basically, it's a free, confidential, in-person mental health support program. The City of Toronto is lucky enough to partner with 5 amazing community organizations who deliver this work. The Gerson Crisis Center, as I mentioned, is one. Taibu Community Health Center is one. Two-Spirit People, the First Nations, is another key partner. The Center for the Canadian Mental Health and Addictions, CMHA, is another major partner, and Find Help 211 is our dispatch and intake partner. The service supports people who are above the age of 16 and is available 24 hours a day, 7 days a week, and so far has responded to over 22,000 calls. And the service has been able to successfully handle these calls 78% of the time with no police involvement. The service was built out to be 2 trained mental health clinicians who respond to calls, and it has been able to reduce calls to Toronto Police Services by 4.5%, as reported by Toronto Police Services in 2023. But I think beyond reducing the load on our emergency services, the service has been able to connect people to vital supports and have been able to help people be able to get back on a journey of health and support, and have trained mental health clinicians who are able to share their personal experiences of and lived experiences of mental health and addictions challenges with others, and be able to help people in their time of most need. The next initiative that I want to talk to you about is called Focus. Focus is a situation table. Again, I told you and I warned you that we like acronyms. Furthering our community by uniting services, Focus. So it's a collaborative, risk-driven community safety model that's co-led by the City of Toronto, United Way, and Toronto Police Services. The idea behind Focus is to identify emergent situations through a methodology called acutely elevated risks, to provide immediate supports to those individuals in terms of the risks that are brought to tables, and to help reduce that risk with wraparound supports. We have over 180 community organizations that are part of Focus, including various institutions like Toronto Police, the City of Toronto, Toronto Community Housing Corporation, the Toronto District School Board, Toronto Catholic District School Board. And whenever they see a risk that's sort of developing. Let's say there is a student who's being involved in a lot of issues in school. Let's say there is somebody who has a hoarding situation. They're able to bring those types of situations to Focus, and then when they're able, or Spider, which is another table, and then figure out who are the right partners to respond immediately to help lower the risks. Some of the top risks that we have seen is around mental health being a major challenge. About 75% of our cases in 2024, antisocial or negative behavior around 46%, and basic needs being food or shelter around 45%. In 2024, with Focus, we've been able to provide support to about almost 1,948 individuals who are experiencing acutely elevated risk, and help lower that risk in close to 90% of those cases. The next slide is the Downtown East Action Plan, which is the last bit that I'll talk about. Councillor Moise has championed the Downtown East Action Plan, and it's a geographic place-based safety plan. It really targets work around Moss Park, St. Jamestown, Church and Wellesley, Cabbagetown, and Regent Park. And in the next slide, I'll talk a little bit more about why the plan is focused on the Downtown East. A couple of key considerations is around the unique nature and drivers of overall safety and well-being in the Downtown East. As an example, in 2024, in April, there were 10,964 people experiencing homelessness in the City of Toronto, and about 23 of those shelter locations that provide supports are based in the Downtown East, providing close to 1,685 shelter beds. About 9% of community service organizations in Toronto are based in the Downtown East. And what we've seen with the drug toxicity crisis across our city and our country, there's been unfortunately close to 4,514 non-fatal and 288 fatal calls for suspected opioid overdoses. And the highest neighborhoods in terms of those calls were the Downtown Yonge East as well as Moss Park. So there's significant challenges that have been identified, and a targeted safety plan that involved community and help involve multiple partners was one of the goals of the Downtown East. The next slide, I'll talk about how this really builds on a 5-year action plan that began in 2019 and that was renewed from 2025 to 2030. It involves 32 key actions in 4 areas. Number 1, building safe and welcoming inclusive communities. 2, building cross-sectoral trust and collaboration. 3, stability for people experiencing marginalization. And 4, building a model for a city to respond to complex issues in a particular geography. So what does this look like concretely? Let's go to the last slide. I'm going to just mention 4 major initiatives in the Downtown East. One is called COAST. It's the Community Outreach and Support Team. It's based out of the Regent Park Community Health Center. And it's the low barrier outreach-based intensive case management supports for individuals with multiple barriers. And it serves the Dundas, Sherbourne, Church and Wellesley, and Yonge and Dundas area. There's also the Here to Help initiative, which Susan, who leads up the Gerstein Crisis Center, is a major partner. They provide a multidisciplinary team that provides timely de-escalation and crisis intervention response, and is really on the ground team that connects with people and provides supports. The third one is the Community Cares Harm Reduction Cleanup Project, which is led by Passan. It's a peer employment program providing cleanup and safe disposal of harm reduction supplies in the Downtown East. And last but not least, the Justice Centers. This is an initiative that's actually led by the Ministry of Attorney General that works in conjunction with community partners like Regent Park Community Health Center, Surrey Place, Loft Community Services, Jean Tweed, and Toronto Police Services. The Justice Center is taking a unique approach of trying to provide supports for individuals experiencing homelessness and addictions issues, and trying to provide a hybrid justice and healthcare approach that tries to prevent people from cycling through the courts. The City of Toronto partners on the support side, while the Ministry of Attorney General provides the court administration supports. And what we are seeing is a large number of recidivism dropping, and people not returning to the courts over and over again who were provided the wraparound support. So these are just some of the initiatives that are happening in the Downtown East. A lot of these initiatives touch on the intersection of mental health and addictions, and provide and oftentimes are serviced through and built with community partners. So I'll stop there, and happy to take any questions as we talk throughout the day.
Thank you, Mohammed. Very thorough. And you're not wrong. We love our acronyms in the city. It's a different language altogether. Next up is Kate Millen, is the Senior Policy and Strategic Issues Advisor of Toronto Public Health. Coming up, Kate. It's out of your way.
Thank you. Hey, good evening, everyone. Thank you to Councillor Moise for the invitation to join you all this evening. Happy to be here on behalf of Toronto Public Health and share some information about the work that we do to promote positive mental health and well-being, and also addressing substance use in the City of Toronto. Next slide, please. So on this slide, you'll see a picture of the strategy that guides some of our work in mental health and substance use across the city. It's a strategy called Our Health, Our City. Very long subtitle, a mental health, substance use, harm reduction, and treatment strategy for Toronto. So this is a comprehensive 5-year strategy aimed at reducing substance use related harms and promoting mental health and well-being. The strategy is available online and offers a range of recommended actions across 7 strategic goals. There's like around 70 recommended actions. There's a lot to dig your teeth into. And it was adopted by the Board of Health in November 2023, which means that we are in the early days of implementation, and our efforts are guided by an implementation panel, which is providing advice to support making some progress in some of the areas in the strategy. This implementation panel actually is filled with members from the community and from the public. We had over 160 individuals apply, including 40 people with lived and living experience of mental health or substance use. And so we meet with them regularly and really appreciate their advice and guidance as we work towards improving some of these challenges facing the city. Next slide, please. And the next one. Yeah. Thank you. Okay, so public health and mental health. I just wanted to spend a little bit of time explaining what public health is and how we work in this space. So public health works to protect and improve health by using science, evidence, and best practices. We focus on the health of groups, so not just individuals. We take a population level approach to some of these challenges in front of us. It helps promote the factors that improve health and prevent causes of illness and injuries. So we oftentimes think about accessing healthcare services by going to your family doctor or going to a community clinic. Public health tries to be a little bit more upstream and prevent some of these things from happening in the first place. So public health does a lot to ensure the food that you eat is safe, the water quality is, healthy and drinkable. And we often say that if public health is doing our job well, you won't notice us at all. We're kind of in the background doing that prevention work. So when it comes to public health and mental health, what we do is focused on mental health promotion, and we do a lot of data and information sharing as well as we monitor what's going on at the population level. Next slide, please. We are also guided by a strategic plan. So this is a strategic plan that takes us into the year 2028 and includes a vision where we have a city where all people can be healthy and thrive. That's really what our work is focused on. This was recently adopted by the Board of Health and includes 5 priority areas, also available online, but I did want to flag that priority 3 includes promoting the conditions to support positive mental health and reduce the harms of substance use. So this is one of the key priority areas for the City of Toronto and also Toronto Public Health. Next slide, please. So I mentioned that one of our key roles is in data collection and kind of keeping our eye on how the communities are doing. And a lot of this information is available online. So we have a mental health and substance use population health status indicator dashboard. We call it FISI. That's another fun acronym. And it's updated regularly and provides some information on the mental health status and behaviors of substance use among adults in Toronto. We have a separate source of information for children and youth, and that can be found in the Children and Youth Health Dashboard. So some of the data highlights included in this information that is publicly available is that, we're not doing so great when it comes to mental health across the city. The percent of adults in Toronto who rated their mental health as very good or excellent decreased from 73.4% in 2015 down to 65% in 2020. And we know that, COVID-19 also included some mental health challenges for our community. And so we weren't starting from a very strong place to begin with. In 2019 and 2020, self-rated mental health among adults in Toronto actually varies by some different factors, and that includes education, gender, ethno-racial identity, and also income group. And we're seeing a really low percentage of adults 18 years of age and older in Toronto that have reported having seen or talked to a health professional about their emotional or mental health in the past 12 months. Next slide, please. So the key kind of takeaway and message I wanted to share with you all today in the room and also online is that it's okay to not feel okay. There's lots of mental health resources that are available to help you. This information is on the city's website. It includes a range of resources, a lot of different numbers that you can call. And, the city is working hard to make sure that we clarify which number is the kind of right door for you to access those services. So while I have you here today, just a quick reminder, it's 911 if you're in an emergency. If you or someone you know is thinking about suicide, there's another line for that. You can call or text 988. 211 will help you get connected to a range of other services that will best meet your needs. So just wanted to make sure you have that information. And if you have any questions, feel free to chat with me after as well. Toronto Public Health does takes some steps to offer programs and intervention programs for priority populations. I've got a couple examples of those up on the slide to give you a sense of how Toronto Public Health works in the community. So one is the Perinatal Adjustment Program, which is a service offered to parents who are experiencing symptoms of postpartum depression or anxiety. And this is a collaboration between Toronto Public Health and community hospitals and agencies that are striving to decrease the impact of perinatal mood disorder, PMD, on the parent-infant relationship. We also do a lot of work in schools. And so there's some information about our school health team, which includes public health nurses. And, we work really closely with the school administrators, educators, parents, and caregivers to make sure that we have public health services and programming available for students as well. Next slide, please. So this brings me to the second half of the presentation, which is a little bit about substance use. Next slide, please. So substance use, what are we talking about here? Substance use exists on a spectrum. So you can not use any substances at all, You can have some regular use, some dependence, and this can change over time. It's a really dynamic part of people's lives. Some substance use patterns can be medically classified as a disorder or present some significant problems, but many people do use substances in a way that are lower risk. So, and when we talk about substance use, we're including the harms of alcohol, tobacco, cannabis, and other drugs. Next slide, please. So again, I mentioned that one of our key roles here is about monitoring and sharing data related to substance use patterns across the city. So there's some information about what we're seeing on tobacco. It's still responsible for a significant amount of healthcare system usage. We're seeing, 11,000 hospitalizations, almost 16,000 emergency department visits attributed to tobacco smoking. And this is for people 35 and older between the years 2015 and 2019. Of course, alcohol is, one of the most widely consumed substances, and it is harmful to your health. So the current kind of takeaway on alcohol message I'd like to leave you with today is the less alcohol that you drink, the better. That's kind of our rule of thumb at TPH. There is new guidance on alcohol, and that's also available online that was released in 2023. Finally, and Mo mentioned this in your presentation, we are in the midst and continue to be in the midst of a drug toxicity epidemic. Unfortunately, between 2015 and 2023, we've seen approximately 3,400 people die of opioid-related toxicity across the city. These are people's friends, these are community members, and with the appropriate and comprehensive continuum of evidence-based services and supports, these overdose deaths can be prevented. So this is, some of the core work that we're doing at Toronto Public Health with our community partners as well. Next slide, please. So an example of some of the ways we work to reduce harms in our community is by offering some specific harm reduction services and programs. We have street and mobile van outreach programs that, distribute harm reduction supplies, which includes naloxone. And, we work to connect clients to the services offered throughout the city already and offered through our newly added service, the Homelessness and Addiction Recovery Treatment, or Heart Hub. We also partner with community agencies to distribute harm reduction supplies across the city. So I can't remember the last count, but it's almost 100, I think, different community agencies that we coordinate with to do that work. We have naloxone training available online in many different languages, so I encourage you to check that out as well. And we also have a very great partnership with our friends at Toronto Paramedic Service to work with them and monitor the daily calls for fatal and non-fatal overdoses. So we work with them to get that daily data. And we monitor for any kind of changes to the data, anything that we find concerning, and make a decision to issue a drug alert to our community partners when we see something that, we want to raise the alarm about and ensure people have the information they need to make healthy choices. Finally, another great program that I have to mention today is the Downtown Community Outreach Response and Engagement, another acronym, the CORE team. This is a street outreach-based pilot program that operates in the Yonge Dundas area and is showing really incredible initial results. It's not a service that you can call. It's, like I mentioned before, one of those services that's more upstream, out in the community, and more proactively having conversations with folks who may benefit from some additional support. Next slide, please. Okay, so this is just some information for everyone here today in terms of what you can do if you encounter someone experiencing an overdose. We have a lot of resources available online. If you're curious, you can check them out. There's information about how you can get a naloxone kit. There's, a 5-step information about what you can do in the case of providing an overdose response, and some updated information about where you can find services, especially as some of our services change across the city, as Councillor Moise mentioned earlier tonight. I believe that is the end of the presentation. Happy to answer any questions later. Thank you. Thanks.
Thank you, Katie. I'm very privileged and honored to chair public health and 2,300 plus strong people working across the city every day. Thank you. Up next is Susan Davies, is the Executive Director of the Gerstein Crisis Center, also located in Toronto Center. I had the privilege of working with Gerstein when I was at the hospital for 22 years. So I know the service well. I'm happy that you're part of the team now. Oh. Thank you.
Thank you. Thanks so much. And it's really always a really wonderful opportunity when people convene people together to talk about mental health. It's something that we know we need to do. It's something that we all experience, and every opportunity we have to talk about it is so important in making sure that people get the supports they need. I'm also really honored to be here with everybody on the panel. We work very closely with all of them and many of our partners to be able to serve the communities in ways that hopefully brings coordinated and better access to the supports people need. So I'll talk a little bit about Gerstein Crisis Center, and along the way, maybe add in a few other things. But we could maybe go to the next slide if you'd like. Gerstein Crisis Center really is working on what we would call no wrong door. And I know we've got a campaign in the city about making the right call, which is really important. And I think what's important about that is people not having to knock on a lot of doors before they get to the door that's going to lead them somewhere. But I think the most important thing is that whatever door somebody knocks on, that they actually get connected to the right resource for them. So it's not like they did something wrong. There's no wrong door. And that's really what we're trying to build and create as a city, and as really through the health system as well, that access is a whole lot easier than it has been, because I'm probably not telling you anything that you don't already know, but access to mental health care has been a real challenge for some time. We have capacity issues. You have people who are seeking the supports who can't access it. And, that has led to, many kinds of challenges in our community and for individuals across the city. And it's really important that what we do is build a stronger, more connected system that works across sectors and across ministries to really build what our communities need for better mental health, and also what our cities need for more empathetic, caring communities. And so such important, initiatives that we really are very happy at Gerstein Center to be part of. I'm going to go to the next slide. Because we've been providing community-based crisis response in the city of Toronto for 35 years. It's getting to be a long time. We were sort of a brand new thing way back when, because we are non-medical. We're not connected to a hospital. We are truly community-based. And we really, I think the first slide said, really try to center the voices of people with mental health in the work that we do, and allowing them to drive what it is their needs are, and also work very collaboratively with them to also figure out what are the solutions to what's going on for them. So we have, obviously we're rooted in community-based, non-coercive, trauma-informed, and harm reduction approaches that are grounded in the involvement and leadership of people with lived experience. And what I mean by that is that we have people with lived experience at all levels of Gerstein Center. Even 35 years ago, at least 30% of our board of directors has been people with lived experience. And throughout the team, we've always hired people with lived experience to work alongside and be part of and to drive the services at Gerstein Center. And, the belief there is really to make sure that we stay vigilantly sensitized to the needs of the communities we're serving, and to make sure that that expertise, which is immense, is really being able to be leveraged and have impact in building communities that build stronger mental health. We also recognize the importance of listening to the individual in crisis and creating access to services to get people the help they want and need sooner, and where it is that they need. So while we have locations where we have short-term crisis beds, we're also mobile, and we go out to the community and meet the people where they are at. And, part of that is also making sure that, as I said earlier, we're non-medical. So we're not driven by diagnosis. I think diagnosis can be a really important thing in someone's recovery, but unfortunately, it can also sometimes not let them get to what are the real issues that are at hand, and allow them to sort of drive their mental health and well-being moving forward. So really believing that people are the experts about themselves, and trying to really allow them to sort of drive what it is their needs are, and hopefully us support what that can look like and connect them to resources that are going to be hopeful. We strongly believe that a model that allows for the earliest response to mental health crisis is provided by a mental health worker rather than the police. And we believe that's going to reduce harm and stigma, and of course, unnecessary police involvement. We already know, unfortunately, that we have a large number of people who wind up in our criminal justice system, in our correctional facilities, and as well, more police contact than they would really want to have, largely rooted in the fact that they are living with mental health concerns or some of the crossovers of the social determinants that impact people's well-being and mental health. And so really trying to move away from a coercive response to a more, human rights-based and humanistic response is so key in terms of making it possible for people to feel safe to reach out, and also, reduce stigma and allow them to access services so that they can, get the support that they need. Oh, not quite yet. Maybe that's like the hook that's taking me off. I don't know. So we know that equity-based, anti-oppressive and anti-racism approach is essential to creating systems that promote health and well-being. We know our Indigenous communities are overrepresented in our correctional facilities. We know that Black and Indigenous communities and other racialized communities have more contact with police. We also know that if you are going to have contact with police during a mental health crisis and you have the intersection of being racialized, you're more likely to be arrested versus apprehended. And these are things that we really need to change. And so there's no going forward without making sure we're going forward with everybody, including everybody. And one more. We value the collaboration to strengthen service pathways. You're going to see, we talked about a lot of initiatives tonight. Gerstein Center is connected to so many of them. We really do believe in partnership. We don't think we have all the answers. There's a lot of communities that we work with where there is complexity, and there are people who deal with that are far better equipped to do that. So we partner, and then what happens there is we get the expertise that comes together, and we also get the ability to flow people to the right services that they need. So these are all sort of the principles and beginnings of Gerstein Center. Now we're ready. Sorry. So, there's guiding principles. These guiding principles are Gerstein's guiding principles. We also had the ability to have influence with the Toronto Community Crisis Service, and you'll see a lot of them overlap. But really, services are provided in the least restrictive way possible. That means that, try to be low barrier, try to make it not a lot of criteria. People can present as their own. Helping the individual to regain control is so essential. When people are in crisis, what's happening is that whatever they usually do to cope is not working. And it doesn't mean it's gone. It doesn't mean they don't have a ton of strengths. It doesn't mean they don't have the solutions. They're just not connecting to it in that moment. And getting people making decisions and able to, be part of their recovery is essential. Access to supports are timely and directly available to the person. You're going to see later a little bit more about that people can define their own crisis. I'm not there to tell them what's wrong with them. They're there to tell us what's wrong and what they need. And that, crisis services are provided by competent, well-trained staff that really are, seeking a comprehensive understanding from the individual, not thinking that they already know what's going on, but really trying to hear what the person has to say. And that they're congruent with culture, race, gender, and age, sexual orientation, health literacy, and communication of the individual in crisis. That sometimes it's really important that people are able to access what is most close to them, what's at home to them. And that's really important. There's also times where people want to break out of that, and that's okay too, but they need choice and they need access. And it's so important that that is available, and that cultural competency is part of whatever you do. Adequate time is spent with the individual crisis. So many people we talk to, it's like, get through the system. Everything's busy. We got to move on. There's got to be time spent because it takes a little bit of time. And I know Wanasa knows that too, to spend time with people. So the lived experience part I already talked about. I would tell you about 67% of our staff would self-identify of lived experience with mental health. And when I say that, they're not there as peer workers. They're there as crisis workers. They've got 3 to 5 years of work experience prior to coming on. And they may have all sorts of other things on top of lived experience, or maybe not. Maybe they've really come up through the system, but that's expertise, and we value that. And they're on the team full on as a crisis worker. Valuing that expertise is so important. And part of the importance of that is people seeing that recovery is possible, and that there's people that get what it is they're going through. And then plans are strength-based. As I said earlier, people do know what their solutions are. And communities in partnership with strong knowledge are utilized to prevail well coordinated care, which we've already touched on. Okay, we can go to the next slide. So this is just a little bit more on that. I think it's just to understand what the approach is. The person's at the center. That's where strength is. They have a lot of expertise. We're going to use equity and access. We're going to really build on empathy and understanding, collaborative problem solving, looking at reducing harm. And that's whether or not it's with substance or whether it's with mental health or other kinds of factors that may be impacting people like homelessness. And so really trying to reduce harm where we can. And, coordination, which is really trying to smooth out pathways and help people get connected to the services they need. And we'll go to the next slide. So this is, not a straight road. I think we all know that when you're dealing with mental health, and especially when you're dealing with systems, it's a bit of a windy one. But this is just giving you a sense of some of the services that are available at Gerstein Center. You'll see at the beginning about access points. And so we have a 24-hour crisis line that has operated for the 35 years where we answer 30 to 40,000 calls every year from people in crisis. We also now are connected through TCCS, through 211, and really as 911 diversion, which is, also a key component of moving people away from that police response is actually having a strong diversion plan so that can happen. And then we're also partnered in with 988, which is Public Health Canada, who has and CAMH, Center for Addiction and Mental Health, that has got a national suicide prevention line. And so we have some people answering that line as well. And also we're venturing into the world of texting there as well. And we'll see whether we can add that to our services at some point. So we really like that multiple access. You're going to hear later that we're located in some different places in the community that also is about access, including the Toronto Public Libraries. So it's really important that people, wherever they show up, are getting to the services they need. We have a mobile team, number of mobile teams now. We have always had a mobile team that covered the whole city, just one team for 30 years. And more recently, through investments with the Toronto Community Crisis Service, we've been able to add more mobile teams, and which is just fantastic because it's allowing us to reach more people, but also to really ground that work in the communities in which people are living. And so a really valuable resource that we are now able to offer enough kind of resource in the community that we can truly be that alternative response. It's hard when there's not enough capacity to make it a real alternative. And then we have crisis beds. We have 10 short-term crisis beds that offer 3 to 5 day stays. And we also have 14 beds at a different location that 9 of them are mental health and justice. We're taking folks out of correctional facilities or in presence of police officers or on bail or with probation. So they're currently involved with the justice system, but mental health is at the core of that. We have about a 30-day stay which is longer these days, unfortunately, due to not being able to connect them as quickly. But then the work is done to really try and connect them to resources. And then 5 of those beds at that location are for women who are experiencing homelessness and mental health crisis. And again, it's another 30-day model. We have 6 beds located at the withdrawal management site for St. Mike's that are specifically harm reduction beds, offering 30-day stay again for when we've got concurrent mental health and substance use together. We also have beds through Luminous, which is a developmental sector service that for people who are dealing with dual diagnosis, both developmental and mental health. And so you'll see that's what I was talking about earlier when we talk about partnership and making sure we build on the expertise and bring it together so we can serve communities in the best way possible. We have the crisis bed that we have follow-up, obviously, that the TCCS has it really nicely built in with 90 days of follow-up post-crisis and a number of partners that are involved as well in helping us with the ongoing supports that people need. We also offer recovery and wellness activities, and we have training and education. We do suicide intervention training, crisis de-escalation training, and mental health awareness in the community. So those are all the things that we have kind of going on at Gerstein. We'll go to the next slide. And these are just, some of the services. I mentioned them as we were going through. I won't go through them in great detail. You'll recognize some of them because they were mentioned in previous presentations tonight, like Focus, and the some of the other services will come up on the next page. So Gerson Crisis Center has been funded for 35 years by the Ministry of Health, and then more recently been through the City of Toronto through the Toronto Community Crisis Service. So these are more of our Ministry of Health funded services, and that includes a substance use crisis team, the Gerson en Bloor mental health and justice program, the women's crisis beds, and our 24-hour crisis line mobile team and crisis beds at Charles Street. We'll go to the next page. These are more where we've kind of combined with the city. And I think one of the real values here, and I think what is so important, is that we are connecting mental health crisis services to municipal services, which people are more familiar with sometimes and able to access mental health services in ways that they weren't able to before. And we have Here to Help, which is also funded through the city. Mo spoke about it a little bit. I want to just add to that part of his presentation to say that this is really designed specifically for shopkeepers and community members in the Church, Wellesley, and in the Moss Park area who were finding it really difficult with a number of things that were happening on the streets, and we didn't really want to have to call police anymore. And also the community who didn't want the police being called. And so we've done some incredible work, really reducing the amount of calls to police, and as well, building what we would call more caring communities where people felt like they had other resources that were more responsive, and as well an alternative where they didn't have to call the police, so they could actually care about what was happening and not feeling so combative. So it's been very successful in that way. Got some awards and everything, and just really very, very positive. I'd love to see us do this in other neighborhoods, would have different kinds of, focused areas, but I think it's been really valuable and lots of learning. Talked about 988 already. And then the Toronto Public Library is very exciting. We're expanding there this year, but we've had crisis workers located in some key downtown libraries to be able to respond to some of the needs that are coming in, that are either really, they're really kind of the front lines of things in a lot of ways because they're open. They have, a washroom. They are a public space where you don't have to go in and be surrounded by, a lot of other activities that are going on. It feels, very much like it's there for everybody. And it's really wonderful that the crisis teams have been able to connect with people there. We also are providing programming through our Fresh project, which I'll talk about a little bit. Next slide on that one, which is more on the recovery and wellness side. Fresh is called Finding Recovery Through Exercise, Skills, and Hope, and offers a ton of activities every week where it's delivered by people with lived experience who have used physical activity in their own recovery and share that with others to be part of. It's been extremely popular at the libraries and is going to be part of the expansion moving forward. And then we also have wellness and recovery programming that includes the WRAP program, which is Wellness Recovery Action Planning, 8 weeks of exploring, what are the things that make me feel better? What are the things that make me feel worse? And really developing a crisis plan for how to manage when things get a little more out of hand. And then the training and education, which I already mentioned. And then we'll go to the next slide. It's just a list of the number of partners, and I would say it's not even everybody, but you can see that we're really working hard to stay connected and to build relationships so that the people that we're working with can connect to the right resources at the right time when they need it. So thank you so much for bringing us together and having this, and we'll go to the next one.
Thank you so much. Thank you, Susan. I know of the library initiative, and I received a lot of positive feedback from that. So I'm really happy that you're doing that. And next up is Free Wat Shifra, is the program manager of WANASA, along with Kishka Mohammed is a youth ambassador of WANASA. So it's your turn. Come on up. Thank you. If I mispronounce your name, please correct me.
Testing, 1, 2, 3.
Thank you so much for the introduction, Councillor Moise. And
No problem. Got it. Good. Okay. Um, are we good? Are we in frame? All right. You got it.
Thank you.
Okay. I'll start us off with telling you guys a bit about Wanessa. We are a Black-centered mental health organization running in Regent Park. We have our building just across the street from here, 660 Dundas Street East. We've been running for about 4 years now, officially. But a lot of our mental health work has been going on a bit before that, unofficially. But yeah, and we cater to Black youth in the neighborhood as well as caregivers. Next slide.
Can skip next slide, please. I know we've been introduced. My name is Freya and I'm the program manager at Wanasa.
Yeah. My name is Kishka. I'm a youth ambassador here at Wanessa. I work very closely with the mental health caseworkers. We are also a part of a lot of the behind the scenes events, front page, and as well as like this type of things when it comes to our organization. I'm also an aspiring filmmaker in the community. I work for various organizations when it comes to filming. Next.
So talking about the vision and mission of Wanasa, the vision is safe and inclusive communities where Black youth with mental health and addiction issues would receive services with dignity and a sense of purpose. And the mission is to improve access to effective and holistic mental health services for Black youth and their families in Toronto. That's what makes Wanasa unique, is specific to Black youth, and we are focusing on a Black-centric model. Next slide, please.
Problem analysis. So the need is basically poverty linked with increased incidence of poor mental health, which means like when you're with poverty in this neighborhood, you are more likely to be you're more likely to fall into incidents of like a lot of mental health. Sorry, just zoning out. Societal racism and severity of mental illness, cycle of youth violence and unmet mental health needs, which means that there's a continuous cycle of violence within the youth, and these are things that need to be fixed. Access, the wait time for counseling in Toronto is 280 days. Lack of trauma services. Black youth in Canada are 4 times more likely to enter the mental health care system through their emergency department, meaning like when they're at their lowest. 50% of Black youth encounter 50% of Black youth encounter if you can move your head, police. 50% of Black youth encounter police before mental health services. Yeah, all good. I should have had that memorized. And engagement would be like systematic structural racism, interpersonal racism, and personal family. So like they have problems when it comes to engagement with whether it's like for personal and family, like mental health is kind of hard to talk about within your family. There's stigma, there's a fear, there's interpersonal. So like within doctors and like practitioners, for instance, they might not get you. And as well as systematic structural racism, which is like within the system, employees, work, and outside of that.
I think if I can add a little bit on that. So the engagement, I think this makes, I know that all the panelists, we are focusing on mental health, but this engagement issue makes it even more harder for Black youth, the Black community in general, to receive service and have access to the needs of mental health and addiction issues. Next slide, please.
So this is a video I was hired to film for Wanessa. This is Kenneth. He is a community member. We're getting there. He is one of the community members, community leaders. I'm pretty sure I've seen his car parked outside today. I think he's here. Yeah. He works at Dixon Hall, and he was just telling his story of Wanessa through the vision of our lens. Go for it.
Hey, hi, my name is Kenneth Slater. Worked and lived in Regent Park for a long, long time. The thing I like about Wanasa before it became Wanasa is that it started as a grassroots organization to attack, I think, some of the issues that was happening in the community in a ways where I think other mental health organization wasn't doing that. And I think the way how they are approaching the young people, I think they're seeing the young people for where they are and for who they are. and they're able to meet them at that level. So they're not coming in with almost like, we've got this great thing that we have to offer, and you need to fit into our box. They're really going with that, like, we're here to support, and we want to understand and get you from point A to point B.
I think that video emphasized how WANASA is present in the community. We're not waiting for people to come to the center to receive services, but we are present in schools and partner agencies to provide the service that the youth need. So the approach, as mentioned earlier, is Black-centric. It's specific to the youth, the Black community in Regent Park. It's holistic. We incorporate spirituality and healing practices in everything that we do. And the youth and family and community-based, as I said, we are embedded in the community and healing-centered and trauma-informed. We're not looking at youth who need services as something is wrong with them, but we look at their background and the situation and why they are experiencing the issues, mental health or otherwise. Next slide, please.
These are some of our youth ambassadors. Some of them are really recognizable from our neighborhood. And our founding members, Namera again, Leslie on the side. Pretty much. Next slide. Yeah, that was me up there still. This is another video I filmed, which is another perspective of what a youth ambassador looks like here at WANASA, explained by Hadil. Without further ado.
Hello, my name is Hadil. I'm a youth ambassador here at WANASA. Having youth ambassadors is very crucial to WANASA's mission, which focuses on a Black-centric approach to mental health services and creating less barriers when approaching mental health. A little bit about what we do here. We sit in on interviews and we make sure that folks are a good fit, not only for the staff here at WANASA, but the community as a whole. We also help with event planning and community outreach. As youth ambassadors, our voices are heard, our perspectives are respected, and we are encouraged to advocate not only for ourselves, but for our community as a whole.
Like that the youth in the community are involved in everything we do because they relate to what other youth are experiencing, which highlights the need for more youth to be involved in the programs and services that we provide. So to go through the services that we provide, we have different programs and services that are specific to youth between the ages of 12 and 25 and their caregivers who are experiencing mental health and substance use issues. And we have also partner organizations in the community and youth ambassadors, as mentioned earlier, providing Black-centric mental health and addiction services. Our programs, as mentioned, are for Black youth and their families in Regent Park and surrounding areas. I think the highlight what WANASA stands for is it's trauma-informed, healing-centered, Black-centric, and culturally appropriate and spiritually affirming, using a spiritually affirming lens. Next slide, please. So this is the process how we provide services. We have individual therapy, we have group therapy and workshops. The group therapy or workshop, they could happen in the community. As mentioned earlier, there are schools and partner organizations who are part of our work. And then there is also service navigation. Black youth who come to WANASA, we will connect them or refer them to other organizations who might be providing services that they may need. And then there is also mental health and case management involved. And throughout the process, we have outreach and engagement and also crisis support in the community. We don't do crisis intervention, but we provide support during crisis. Next slide, please. So as mentioned, we provide counseling and therapy. There might be one-on-one sessions or group sessions, and then it could be through in phone, in person, as well as virtual. And then the groups sessions, they are in person. And then we also have caregivers support group for mothers and caregivers. Our Dear Hawa runs that program. And then we also have wellness drop-in programs at K Club, Dixon Hall, and we're planning to expand it to MLSE and other partner organizations as well. And as mentioned, in the school, and we'll talk about in the next slide. And then we are engaging with community doing outreach. We are also present in, we do home visits. Oops, can you go back to the slide? We provide home visits. We do information sessions, psychoeducation workshops, and community events, just to highlight how WANASA is present in the community. Next slide, please. So as mentioned, maybe to this, I'll have you talk about the schools.
So our programs and services in 2025, even 2024 onward, we are currently present in schools, a couple local schools, planning to be more just now. Nelson Mandela Park Public School, which is right next door. We have a wellness group for girls, grades 7 to 8 on Tuesdays, and Jarvis Collegiate, which is actually the homeschool high school of Regent Park. If anybody lives in Regent Park, we have a wellness drop-in on Mondays, and we do also plan on expanding to all the other local schools. Like there's also like Lord Dufferin and Central Tech, which we're missing on, but we're going to cover that sooner than later. Fun.
So thank you. Yeah, we're planning to expand the school programs. And we also have Life Stabilization Fund, which is funded through the city. And it's application based. Clients who the staff need would benefit from the fund would be going through the process, and they need to be dealing with gang and violence related activities, such as well as justice involvement. And the age group is from 12 to 29, which is the target group for WANASA. As we know that the community also requires the fund tries to solve other issues, because the social determinants of health is what makes people vulnerable to mental health. So the fund that's provided include food security, housing, as well as other supports, including education and employment. And we also provide crisis support, as mentioned earlier. We are present in the community. We are not waiting for people to come to us, but we go and meet them where they are. Next slide, please. We are in the process of partnering with Unity Health. It's called Transitional Age Youth Program, where the youth will be receiving one-on-one therapy, and the age group is between 16 and 29. They will have access to psychiatrists from Unity Health. And the most important thing about this program is it's also developed through the Black-centric trauma-informed model that WANASA is using. And we are in the process of starting that program as well. We are in the hiring process. And then we are also one of the referral agencies in the community. We partner with Regent Park Community Health Center. We refer our clients for primary care support. And also the Downtown East Ontario Health Teams is a part of our partners. Next slide, please.
This is pretty much the care pathway, like how we kind of get our clients into our organization. So it would start with either community support workers or self-referral. This is pretty much how we get the clients. They would be referred to us either through agency providers, family and friends, or the other. From then on, we would bring them into an intake, which is the intake process through our mental health workers or our caseworkers or program managers, whoever's available to take them at the time. And based on the intake, we would decide whether to throw them into individual therapy or group therapy or support groups alongside with case management. This can basically be gone in any direction. They don't have to go through individual therapy. Some might be good for group therapy through a support group and straight out, or some might go through all three. Some might just need individual therapy. And based off of that is when we decide whether to discharge, or if we feel like that our capabilities haven't met you enough, then we would do an external referral with follow-up so that we don't leave you just hanging behind the scenes. Next slide. A little thank you to our partners, very important partners that some are not even mentioned, but they pretty much help us keep WANASA going. We have Black Health Alliance, Toronto Community Housing, MLSC Launchpad, Dixon Hall, BGC, which is K Club, TNG, Regent Park Community Health Center, and the City of Toronto. Thank you so much. And thank you so much, guys, for listening. And
Thank you for your time.
yeah.
Thank you, Team WANASA.
Thank you so much.
I know that historically Black people don't really engage the healthcare system. because they don't see themselves in it. So it's really important that the work that you do is really important. So thank you for all you do for our community. I'm going to make myself a little comfortable, and I will ask maybe the first question, possibly the second question, and then I'll throw it out to the audience if you have any questions. Okay, that sounds reasonable. All righty. I will start it off slow and easy. We're all good? All right. What are the biggest misconceptions about people experiencing addictions or mental illness in downtown Toronto?
Biggest misconceptions for the, could you repeat that? Sorry. I didn't get
What are the biggest misconceptions about people who are experiencing addictions or mental health?
People think that when it comes to people experiencing mental health or addictions, they immediately think that they did that to themselves and they could probably overcome it in whatever way they can. It's not something easy to just go through on your own. And sometimes when you're at your lowest, it's never too late to basically, like, I'd say, be cared for. It's people think that mental health is not something that's easy to, it's something that should be dismissed, but I feel like when it comes to Vanessa, we are like that door that opens up to people to have access when it comes to expressing about your mental health concerns.
Wonderful. I know working in the field myself for many years, I can say that not everyone, started out being addicted, right? I mean, these are people that, had mothers and fathers, brothers and sisters. They have loved ones. Something happened in their lives at some point that they are where they are today. And so we need to support them, and make sure that they feel better. Any other thoughts on that?
Sure. I do have something to add to this great question, and it's about how we talk about overdose. And I just wanted to give some new language maybe for the folks joining us today, because we often talk about the drug toxicity crisis. And we use that language because the unregulated street drug supply is really dynamic. It changes a lot. And I think when we use the word overdose, it means that maybe people know what's in their dose, and oftentimes they don't, because it's an unregulated substance. So I think, for people trying substances for the first time, it could be just as risky as someone who, is using a little bit more regularly. So I just wanted to talk about the language and explain that when we say the drug toxicity crisis, what we mean is that the street supply is so dynamic, it's unregulated, it's very dangerous. There's a lot of other substances mixed in. And that's one of the really key components that's contributing to the drug toxicity epidemic that we're facing in Toronto and honestly all across Canada. So.
And this is why it's so important to check the drugs
Exactly.
on a regular basis, because what some may be using downtown Toronto may not be the same what they're using in Scarborough, Etobicoke. Right?
Exactly. Yes.
And naloxone doesn't always work depending on what's in the drugs. So
Yep, that's right.
I know way more, I know way too much about this subject matter than I'd like to know. You want to?
I was just going to speak to the othering that goes on, how we talk about it, especially in, because we're in downtown East right now and thinking about what that looks like and, what the impact is of people who are living with untreated and uncared for mental health and substance needs. And we other that as though that doesn't exist in our homes, in all of our lives. And I think it's really important to remember that mental health is something that we all as humans live with, that goes up and down, like you were describing earlier, and that it's not something to be what's the right word for it, feared or treated as a problem for the community, but one where we want to really come at it with empathy and caring.
Absolutely. I remember when I was a school board trustee in the last year of the pandemic, I was at Roseville Heights School of the Arts, and one of our young students there overdosed behind the building. And it was an underhouse person who lived behind the building who actually found her ran into the school and asked us to come out. And the vice principal at the time, provided CPR, first aid, well, CPR to until the paramedics came. But again, it could happen anytime, anywhere, and we're all part of the community. I'll ask one more question before I turn it over to the audience. And you touched on this a little bit. What role do social determinants of health, like housing, employment, and food security, play in addictions and mental health struggles? Well, how about you go ahead?
I can start on that. And the data we saw with our focus tables is that housing and basic needs are some of the top risk factors. Without stable housing, without the ability to purchase healthy food, and also have social support systems, people are at greater risk of mental health and potential addictions. So we see that borne out both in terms of situations we get at our focus tables, but I think more broadly, we've seen that borne out in some of the crisis calls we get through the Toronto Community Crisis Service. So it's part of the social determinants of health, addressing and providing supports in terms of roof over somebody's head as a basic minimum, providing some minimum life stabilization supports, as you guys pointed out, in terms of being able to get on public transit, to be able to go to the library, get access to the internet and borrow a book, or even having some basic access in terms of having a SIN card, or even being able to get access to one's benefits because they've lost that paperwork over time, do create barriers for people to have an employment and income to be able to stabilize themselves. And without that, it becomes hard to build healthy habits, and becomes very hard to unlock the next steps in terms of supports. So that's what we've seen both with Focus and the Toronto Community Crisis Service.
Thank you. If I can add to that, we mentioned that the Life Stabilization Fund that WANASA provides to our clients, and the issue, like, we are an organization who are formed to provide mental health services for Black youth, but we are seeing people with needs other than mental health services, as mentioned here, like the determinants of health, housing, employment, education, and for youth who are going through violence and through the justice system, they need all that support so that they can get out of those situations and have a formal employment and secure employment and maintain it, and also have their education, just in general, put their life together. So it's not about providing one specific service, but it's helping them in addressing other areas, the determinants of health in general.
And I've always said too, housing is the key, right? Once you have housing, everything else falls into place. I mean, even my staff will tell you, like, we have our state offices down the street, and we have people come in who live in the shelter system and then go to work the next day, just trying to get by, or others just trying to look for a job, with a university degree. One guy had a master's, and, he lived in the shelter, and talking to him is like, talking to any one of you, right? And how did you get to this point in your life? And again, I tell these stories, I probably shouldn't, but, he was helping, support his mom and dad and his sister, and, his parents passed away, and, he just fell through the cracks. Right. So again, it's heartbreaking to hear some of the stories that people walk into our office, asking for help. But it could happen to any one of us at any one point in time. I'm going to turn it over to the audience if you have any questions for our panelists. Go ahead. Because there are people online, we do need you to. Here we go.
Test. Looks like you had a slide on all the impact and the work that you are doing in terms of the numbers. Would you be able to speak to it quickly? Putting you on the spot.
Here we go. So I did mention already that we operate a 24-hour crisis line that answers 30 to 40,000 calls in a year. When for a small period of time during COVID, we actually, weren't as mobile. People didn't want us in their homes, et cetera. We were, we're worried about that. We put some more crisis workers on the line. In those years, we answered over 65,000 calls and probably could have answered more. So it's a big capacity issue. So despite answering that many calls in a year, we could certainly answer more with more resources. So I think that's important. We did 12,023 mobile visits in the community, and that includes our original mobile team, but now that also has all our Toronto Community Crisis Services that are also, and this is in 2024. And so we, are starting to be able to really get out there to far more people. And we have about 587 house stays. I'm going to say right now, we don't have enough crisis beds. We would love to see, and Mo knows this very well, we would love to see a crisis center like the one we have on Charles Street with 10 beds, maybe a few more beds. We'd love to see one in every quarter of Toronto. It's a home-like environment. It allows people to come in, gather themselves. It allows an alternative to a hospital stay when that's not what's needed. Can bring a lot of safety to people. And I'd love to see that happen in a bigger way. And with more mobile services out there, we could really benefit with more beds. And, in terms of training the community, we do a ton of training out in the community around crisis intervention and suicide prevention. And then the recovery sessions, which is largely our FRESH project, but also with the libraries. It's really exciting that they've taken on the programming, because RAP is often a paid program. You don't get it for free, but it's being offered free through the library. And so we're able to spread that in the community in a much bigger way, which is exciting and allows us to really get a lot more people through it. And so we're really looking on that expansion this year, going into more libraries to do even more of that. So thank you.
Thank you. And a second question is your Here to Help program.
Yes.
I saw the days were Tuesday, I think, to Saturday, 2 to 12. What was the rationale behind that to exclude Monday and a Sunday? Is it pure volume of calls that you're receiving those days? Can you walk me through that?
Yeah, I mean, it could be more hours of the day for sure, and more days. So some of it's a bit about funding and what resources we had available to us. And so we tried to pick where we'd have the least amount of, where we have the biggest number of people that we would be connecting with, and do that. And then so that's really all it is looking at volumes and trying to put us where the volumes are the highest.
Oh, really? Any other questions from the audience? Go ahead.
Yeah, I have one question. People died in the street, overdose, and I know many people died in the downtown, over 50 people. My kid's friend, including my son. What kind of solution you have, guys, in the road?
I get to start off by saying how sorry I am for those losses, and that's losses for you and losses for our community, and losses that are not at all something that we can accept. And, I think that there's a lot of efforts that have been in play, including trying to make sure people have safe supply, making sure that they have access to safe, needles exchange and all of that is being actually taken away, all because we think that that's not making our communities as safe as it could be, when we know and the evidence supports that it does make our communities safer. We also know that a lot of overdoses don't happen on the street. They happen behind closed doors. Sure.
Where is tonight into community? I don't see a lot of people lost kids over 4 years, 5 years. I don't see where is community in the bed or nobody and fight, because this moment you have to get it as advice what can help in the community. I don't see. You have to invite into community. No knowledge. Just I hear mental health. I know mental health. Everybody have mental health, different category. But people you have to knowledge, suffer in different way life. You don't have. You have to be, that people humanity being very important. I don't know people why he come here lose life. No, you don't have hope. And say that in city help billions. Billions is not help people better way life, take care, and the right people. It's not right people. That's what I see.
I think I'll begin Hoyo Hawa by first saying Allah so your son. And you're right. There's more we have to do. There's not enough that's being done. Some of the things that we're trying to do is really trying to partner with organizations like Gerstein, but also Winansa, who is providing specifically culturally relevant supports here in Regent Park. But there's always more for us to do. And today when I came into this rec center, I saw that our youth space was open, and that's one way that the city tries to, in a small way, create safe spaces for youth, as well as partnering with Winansa, as well as providing supports to services like Gerstein that is doing that work. But I think what you touched on in terms of the experiences, particularly for our community, the Somali community, to leave with the trauma that we had back home, to come here and see that violence play out again here is tragic, and seeing so many both young boys and other family members lost to violence in our streets is tragic. And there's simply no answer. There must be more that we can do. And I think, that's why I want to thank Councillor Moise for pulling us together to have this conversation, because there's more solutions that we have to look for.
I'll connect my question to the discussion we're having. I wonder if an evaluation is being done on the nature of the problem that the city is facing. We've got, I don't know, it used to be 12,000 homeless people the last time I checked, or whatever the number is. It's large. 20 years ago, it was not that large. I'm just wondering if, in connection with the concern of the community, if the resources that, I mean, it's great work. It looks amazing what you folks are doing, and I know you're doing great work, but is it sufficient to solve the problem at the rate that the problem exists and at the rate that it's growing? So that's one piece. But going to the challenge, the first question was asked about misconceptions. I'm wondering if education to the public, not when people have an issue, not when their family is in a crisis, but the general public, educating them about the issue would help to shift the momentum behind the politics that gets to the budgets that perhaps would be the issue, that why we don't see people, why we're not getting help. And I had another piece about the social determinants of health, because I feel that in many ways, governments across the world are working against the social determinants of health that at the same time they are supporting. So whatever happened in Toronto with housing, for example, it didn't go well from 2015 to create, it didn't go well for homelessness. So while we're saying we're supporting social determinants of health, there are policies that are working against it. So there's some interesting challenges that exist that without really addressing them, we're going to constantly be pulling people out the water and not stopping them from getting into the water. Thank you.
Yeah, that's an excellent question. All the questions have been wonderful. I'm going to kick this one off, but in the spirit of the question, I can't answer it all by myself. So yes, it's a great question. So what I would like to offer to this room and to my colleagues here on this panel is that we have to work collaboratively, and we do work collaboratively across our programs. And it's something where the municipal, provincial, and federal governments all have a role to play here as well. So I will repeat that theme of collaboration. And when there's, diffuse responsibility, it does make it harder to pinpoint exactly the person responsible or the thing that needs to change. But we all have a role to play within our different organizations. I mentioned Toronto Public Health. We're trying that upstream role, and then you have your healthcare providers that are doing direct service, your crisis intervention workers and emergency rooms that come in kind of further down the stream. But I really just want to emphasize that Evidence-based healthcare interventions are so important, and there's a full continuum of what that could look like, and they all have a role to play. So keeping our eye on the evidence is so critical. To your point about evaluations, I know that many of our programs do kind of program by program evaluations, and taking a look at those all together, I think is a really excellent idea. But I just want to plug that collaboration, and that participation from all levels of government is equally important here in this space. But I will pass it off.
Thank you so much for your comment. And I do think it relates to the previous comment as well. And I can tell you, for our crisis workers who are going out and responding to people all the time who are in crisis, they really feel like they're on their own. They don't have the resources they need to help address some of the underlying issues. So we don't have access to all the mental health care that we need for people. We don't have housing. Like it's, we're a crisis team funded in the city where people don't have anywhere to live. And these are really big issues of racism, issues of our immigration and refugee, like all these political factors that are impacting. And we really do need natural resources, natural communities to form where people are supported by one another and can connect. Like, I really take your point. I don't see that community. That community is not there for me. I don't belong in that community. Those are all things that we really have to take so seriously, because mental health doesn't exist in a vacuum. It is something that has, for all of us, every single one of us, it can go any day, up and down, and sometimes worse than others. But really, these kinds of issues that are really at the political realm, where we really need to see action that's taken to really address what are these underlying issues and build spaces that care, that really do care, and that connect people. And that looks different, and it doesn't look the same for everybody. And so we also have to make sure that when we're building that, we don't just leave anybody out. It's got to work for everybody.
To follow up with your question, one thing I could do is speak for WANESA on WANESA's behalf, our mental health organization that caters to Black youth and caregivers in the organization. You got to understand that we all came from nothing. And when I say nothing, I mean, I'm speaking on like throughout the trauma that we've encountered in this neighborhood. Me as a youth, growing up in this neighborhood, 25 years of my life, knowing all the youth in my neighborhood and the community, mental health is something that's not something that anyone would have ever fathomed speaking about. It's not something that anyone could talk about comfortably or just in general. Whenever a cycle of violence happens in the neighborhood, everyone's keeping it to themselves, probably post on social media. Nobody really knows how to express. And when we hear mental health coming from this community, people always think of trauma and being at your lowest. And when we think of mental health and being at your lowest, the first thing that me and I compare myself to a lot of youth in the community before WANESA is that we think of, CAMH. CAMH is a place that people go when they're at their lowest. That's what we always thought of. But having an organization like WANESA is almost like a stepping stone, a bridge, almost like an invisible barrier that we didn't know that existed. And being in the heart of the community is a good start to like at least contain the mental health, open the doors, and connecting with youth in the neighborhood, including parents and caregivers. Shout out to Auntie Hawa. It opens up a lot of doors where we can actually comfortably talk about mental health, comfortably express about what we're going through with each other. And having youth like me, youth ambassador like me, work in this organization, it engages comfortability with the youth in the neighborhood to talk about mental health, because I grew up in this neighborhood and I myself went through the same thing that a lot of the community went through, as well as Auntie Hawa being an auntie, a part of the community, opens up the doors for parents to come through and speak about mental health so that they don't have to wake up one day and say, hey, like, what's going on with my child? Or I have to wake up one day and say, what's going on with myself? Do I need to go to CAMH? Because that's all I know. Or I'm not going to speak on it. I'm just going to cry, or I'm probably going to turn into like something that I wouldn't want to become. Like, I'm just going to have a mental breakdown. WANESA it's a very important organization to be embedded in communities like this, because a lot of communities are very similar. Communities like Regent Park, there's like Parma Court, PO, like a lot of communities like Regent Park with housing pretty much go through a lot of the same thing, which is like, and when I say a lot of the same thing, I mean like they're not comfortable with talking about mental health, and it's not something that's easily to be talked about, you know? And I'm just speaking from like a community's perspective in Regent Park.
I think to add to the point that you made about prevention, I think that's what's needed to happen, because it seems like the current situation, we are in a crisis mode and we're trying to put the fire out. So we need to do more and provide funds to do large scale prevention in order to result long-term impact. I mean, it's been like 5 weeks. This is my 5th week at WANASA, and there has been a lot of incidents in the community. Yes, we are there to support them, but that's not enough. We need to do more so that we can have a lasting impact. It seems like the funding is like a pocket money to do here and there. It's not lasting, so we need sustainable funding, and that can reach to a larger community. It's not when we see a crisis, we go there and try to resolve it, but we need to do more before the crisis happen.
I know Katie mentioned it as well, touched on it, but also too, the school boards are important as well, right? Because kids spend so much time in the schools. And because I spend so much time there as a trustee, I have relationships with the administration. And even now as a counselor, I always touch base with the local schools and see what their needs are. And they're talking about mental health and even addictions as well. So that's really important to build that trust within the education system. Any other? Go ahead.
Hi there. First of all, I want to say thank you to all of you. I come here today. My name's Melissa, and I come here today as a resident of Ward 13. I come here also as a frontline worker. I'm an addictions counselor with a treatment facility in the Toronto area and in downtown Toronto. So my interest, I guess, or my professional interest was to hear about what the city's doing specifically for substance use disorder treatment programs. And I'm happy to hear, first of all, Katie, thank you very much. Maybe my question that's upcoming might be directed at you, but thank you very much for explaining what the city's doing and just the initiatives over the next 2024 to 2028. I think that'll be something that I'll go home and look into. And thank you, Councillor Moisey, for having this particular conversation going. Mental health is a huge part of the work that we do as well. It's all interconnected. Also with the Gernstein, we deal with a lot of clients that come to us from there as well. So it's an interconnected conversation, definitely. My question basically is, in terms of, there's a lot of work that's being done by the city that's focusing on harm reduction. But in terms of peer support or abstinence-based programming, so where I work, for example, we're a Ministry of Health funded facility, and we focus on abstinence-based programming, which sets the client up to be able to go out into the community after treatment and help themselves in their recovery. What kind of scope, if at all, but hopefully, does the city have in terms of giving initiative to those type of treatment programs? Because I saw, for example, like with Gernstein, Jean Tweed's up there. That's one of our sober living pre-treatment housing suggestions to females. So just in general, what is the city looking at? Maybe what are the initiatives over the next few years to support these type of treatment programs so we can serve the community best? Thank you.
Thank you so much for your question and for coming out tonight. Really appreciate it that you're here. I'm going to start with the first part of your question about the strategic plan for Toronto Public Health. This is something that there will be regular public updates about the progress against some of these action items in the strategies. So along the way, it shouldn't be too hard to find on the website, but there will be regular updates. So please keep an eye out for that, because it is something that we are keeping a close eye on. These are priorities that we're were selected because they're really important. So we're going to keep our eye on that with the Board of Health as well. So that's the strategic plan for Toronto Public Health. Same goes for the Our Health, Our City strategy. We bring an update on that every year to the Board of Health, typically around November. And that's an opportunity again to bring an update to community. And, you know, there's always an opportunity for members of the public to come and make a deputation and ask these questions to the board and find out what's going on. So we do that every year as well. So I hope you find that there's many opportunities to get updates on actions that are happening at the city. So that's just kind of a transparency and action tracking piece. Your question about a range of supports, I think, is what you're asking about and how the city approaches that. And the subtitle of our mental health and substance use strategy is long, and it includes harm reduction and treatment. And when we talk about a full continuum of services and supports, we mean that, and you mentioned this earlier, there's a place for everybody that, you know, meets the needs, what they're hoping to achieve. You know, we often get asked, and, you know, how do you know if something's working? Is your program working? And what I would encourage folks to consider is what does working mean? And every individual will have different goals along their journey. And I think, you know, an abstinence-based treatment program absolutely is a place where folks can go on that journey. Same with programs that may be more focused on harm reduction strategies or a combination, you know, that they're not really in opposition. It's all part of this continuum of interventions. And so that's reflected in the city strategy. You know, we talk about that full continuum of evidence-based healthcare services and supports, and that's really what we're trying to say. And, you know, the provincial government has come out with a new model of care, the Heart Hub, and, you know, these are being stood up. It's very early days, but the T in that Heart Hub is treatment. And I think you'll see over the coming months and weeks as these programs get stood up, a wide range of partners that are involved in that model. So I think there's a place for everybody. And what we're really talking about is more resources all across the board. Right? We've heard about wait times. We know they're too long for a range of services. And so I would just say that, you know, there's space for everybody. And it's really about meeting people where they're at and supporting their individual goals and objectives. And then, you know, we kind of take it from there. So thanks for the question. Yeah.
It's such a good question, so important. And I really think not you know, going like off in all directions, that we really need to see it as one, but also remembering that we have a drug toxicity problem right now, and that's a public health issue where people are losing their lives, and so that requires a different kind of response than just access to treatment and other kinds of, you know, services that people need. And so we can't lose one over the other. We need to. For people to get to treatment, they have to make it there. And so without being able to keep people alive and do life-saving interventions, our teams will at times, you know, do overdose, you know, interventions and, you know, be there when we're not always there. It's not always possible, but where we can, we do. And at the same time, we may, as you already know, make referrals to treatment. It's the whole spectrum, but we've got to keep people alive to get them there.
Hello, good evening. My name is Miguel. Hi, Chris. Hello, everybody. Thank you for putting this important conversation on mental health and addictions. Prior to the pandemic, we were in trouble, big trouble. So now, 5 years later, we're in super trouble. I live at 220 Oak Street here in Regent Park. It's a Toronto community housing building. We have COTA that provides, you know, some support, but it only works from 9 to 5. So, you know, the big dilemma is how we can close the gap of service between 5 and 9 a.m. the next day, because crises happen most of the time overnight. I had to stay for the last 6 months, 3 times at the Gersten Center, because I never experienced this situation in my building where we were keeping away by noises, by someone who was not taking his medications. He fell through the cracks of the service delivery. And as a result, this is the result of the legacy the negligence of previous administrations, management, mayors, provincial premiers, federal prime ministers. We prefer to fund our police, our law enforcement, to put more money into prison systems rather than to put the money where we really need it, which is, in the services. I don't have faith on this hard model. It's just a conglomerate of different agencies and divisions or services providers. How is it possible we're gonna deal with addiction when it's something that comes from oneself to come forward and says, I'm going to stop, quit, and not doing anymore. No matter how much you talk to them, no matter how much you preach to people, it has to come from oneself to say, I had enough. I want to get my life back. I hear from all of you, we want to do more. We want to do more. But what happened is the city budget. When we tell our city officials, our mayor, we want more funding for our neighbors. We see them dying on the street. The answer is no, we don't have money for them, guys. We have money for cops. We have money for EMS. We have money for fire department. We have money for our unions, for our senior management union. That's where we had the money this last year budget. If you do an analysis, all the money went over there. We have a city that has $13 billion. And my question is, sorry, I don't want to stand into a preach. I appreciate that. How we can close the gap between 5 p.m. and 9 a.m. on site, sorry. That's what I want, is to have a service on site. Because a lot of us also, we are getting old. I'm 60, by the way. And I'm gonna need special needs providers, right? As I get old, maybe a diaper, I don't know. But I need services. And I need those services in-house. Thank you.
Sure, if you want to go first, go ahead.
Again, I sit on budget at the city and I sit in various committees at the cities. I actually sit on 31 boards and committees across the city. And some of those committees I sit on and boards is actually FCM, for example, the Federation of Municipalities. I sit on AMO, the Association of Municipalities of Ontario. And so I sit in various tables, giving advice and receiving feedback from various groups and government agencies and organizations. We've invested a lot in social programs in this year's budget. And, I think the group here is a testament to the investments that we've made around the crisis service, which Gersten is part of downtown, the core program with public health and Toronto Police, among others. We've invested a lot of money in housing. I mentioned that housing is an important priority for us at the city. We spend over $2 billion a year in housing across the city, right? If you include TCHC. So again, I could go on and on and on, but it's not lack of putting resources into the system, and we'll continue to do that. So I think it's important to also at least acknowledge the efforts of our staff and our city officials, elected officials, when it comes to those investments. But go ahead.
I guess I could just say I need to acknowledge the fact that people feel like they are left in the community without the resources they need to be well, or to feel supported, or even to feel safe. And I think just to acknowledge that is a lot of people's experience. That you're saying it's yours, and I know it's for a lot of other people as well. Gersten is there 24/7, so we're one of the few. I don't know really other than emergency rooms or whatever, and some housing providers where there's 24-hour support. Not all of them have it, and I think that's a big up for discussion kind of scenario where those kinds of, what we need to do is listen to the people who are living in those environments and what it is that they need. And hopefully services can be responsive to that. I think that's really important. And we also know, though, that, we really have had underinvestment. It's not necessarily the city, it's the province too, in mental health. Like that's just a reality. As much as we've got some nice investments that have made a difference and are important, we do have underinvestment. And you can, speak with the Mental Health Commission of Canada that has done a report that really looked at how we're well under what we should be spending on mental health care, and in terms of comparing us even to, say, England and other countries that would be of equivalent, we're less. We're not spending the percentage that we need on those kinds of services. But on top of that, all the social determinants and other factors in housing and everything is also really important. We know that our mental health depends on not just our access to healthcare, which is a big part of it, but also access to employment, access to community, access to all the things that are part of what keeps us well as a community. And you were describing, somebody not well. And so where you were and where you had safety in that time wasn't safe at that moment because of what was happening, and you need somewhere else to be. And we've got to really take that into consideration in terms of what do we build? How do we build it so that people can be safe and have the supports that they need?
And just to add to what Susan just said too, is that I like to also remind people that mental health is healthcare, addictions is healthcare, and healthcare is a provincial responsibility. And when the province doesn't come to the table, the city has no choice but to intervene, right? A lot of people in our parks, like here in Toronto Centre, in the last summer, we had the most encampments in the city. And a lot of those people in the parks suffer from addictions and mental health. So again, we had to make space and create more warming centers, more, more housing to support those people, right? So again, we don't have the, well, I'll say the deep pockets as the province and the feds do. One of the things we ask, and I continue to ask for at the various tables I say that, is the, percentage or, of the sales tax. Right? If we were to actually have 1%, I mean, we could actually resolve all the social issues that we have right now. But, the provincial government has said no time and time again. So again, our primary source of income or revenue is the tax base, right? Property tax base. And, that's static year after year.
Can I just add one other thing? Sorry, because there's a lot of ministries that would be involved in this too, because we know in our justice system as well, we've got a lot of people living with mental health concerns and overrepresented there. And I would just want to say that right now we're in a bit of a political climate where we're looking at more coercive care, and in an environment where people who want voluntary care can't access it. And so there's these are complicated problems, and they are complicated for many reasons, including how many parts of our system it touches, as opposed to just healthcare, whether it's our justice system and all the others. So, but I think that right now it's a very important moment for us to say, no, we want caring communities, humanistic, based on human rights, inclusive, all the things that need to happen so that we can strengthen mental health overall. That isn't just about direct mental health care, but really policy and action that we as governments take. And it's not just the city, it's all levels of government, but we really are at a moment for calling to action on that.
Hello, everyone. I'd like to take a moment to thank everybody here before I ask my question. My question is related to the recent announcement of the closure of safe consumption sites. Is the city planning on doing something to replace or to add something new that they may think is more beneficial?
Okay, thank you for the question. So supervised consumption service sites, or SCS sites, are evidence-based places where individuals can bring their own substances to use under the supervision of healthcare professionals. So it is one of the tools that we have access to here in Toronto to provide healthcare services and a safe place for people to use their substances. I'd like to give you a sense of the scale of how these sites were used in the city of Toronto. So we did have 10 of these sites. And in 1 year, these 10 sites saw about 94,872 client visits. So we are, some of these sites have closed down due to recent provincial legislation. And we are working with our partners to figure out where these individuals are going to go to receive the care and support that they need. Because in addition to the opportunity to use their substances under medical supervision, trained healthcare professionals, there were also points of access and connection to all the other services that we've been talking about tonight. So it's not really just the loss of that medical model that, prevents overdoses and is right there to reverse the effect of an overdose. It's the loss of that connection point to a whole range of other supports and services that are really important and, help make sure that people don't fall through the cracks. So it's a big change. It's a really big change for the city. And the city is, has done a number of things. Again, this was a provincial decision. So the city has done a number of things since we found out about that decision. So we are monitoring some data related to the impact of the closures because, where are these folks going to go? So we might see an increase in public consumption and what are our plans around that? So we're having those kinds of conversations at the city under the leadership of Councillor Moise and other city divisions and division heads. So we're taking a look at the data, we're monitoring the impact, and the remaining sites that are remaining open are preparing to see an increase in client visits there as well. So, we're working collaboratively to make sure people have the information of what services are available, which ones are open, how the hours have changed. But it is a really big change and it is a service reduction for substance use services across the city. So it's a really good question. I can tell you that we're keeping a really close eye on the data, and that's one of the tools we have in our toolkit. It's able to tell the story of what the impact of these changes are, and that's one of the ways that we advocate for additional resources and additional support, and do our best to try to make positive change in that way. So we're redirecting people to services. We are keeping an eye on the data, and the Board of Health did participate in the recent challenge as an intervener to keep the sites open. So we're using the tools that we have available to us to maximize access to the services that we can offer. So I know it's not a great answer to the question, but thank you so much for raising it because it is a really significant change for our communities. I will say also that it's really dynamic. So, depending on what the judge comes back with and what the final decision is, we may have another set of rules that we're able to operate within. So I don't want to get too much into the specifics of the challenge and the legislation and what the impacts are, but I will say that it's evolving and, could change and we're ready to adapt when we can. Yeah, thanks.
Thank you so much. It is almost 8. So I am going to ask the panelists to say maybe one last word each, 1 sentence, 2 sentences here.
Honestly, meetings like this are very important. I really hope that it really woke us up and at least raised some sort of awareness, gave you guys some sort of information. I'm very appreciative of our panelists over here for kind of explaining what they do. And I feel like it's very important and necessary for the community to continue to evolve and become better and heal, I'd say.
Thank you, Councillor Moise, for inviting us to be here. And we are delighted to be among the panelists here. And mental health is a big issue, and it's so much so for the Black community, the Black youth. So we need to do more. And with the collaboration that was mentioned earlier, I think we can achieve more. And thank you again.
I want to thank all my panelists for a great conversation and Councilor Moise for hosting us. I think what I'm walking away from this conversation with is that if we want to build a more thriving, healthier, and safer city, it's really going to be about ensuring that we think about the dignity of each individual and how do we build that dignity and how do we build that from a lens of a rights-based approach. And I think, mental health and addictions oftentimes are system conversations when they're not really systems. They're people, and people experiencing different barriers and different challenges. And how do we help build up people to not have those barriers and not have those challenges? And government has a key role to play. And we all as a community have a key role to play to advocate and to protect our neighbors and our friends.
Thank you. I do. Thank you to the panelists and to Councillor Moise and to everyone for coming out tonight. I really appreciate your effort and the time that you took to be here. I think what I would like to leave people with is just recognizing the trauma that our frontline service workers are also experiencing and in our communities. You know, we've been in the midst of a drug toxicity epidemic for years. And, you know, we have our frontline service workers and our first responders and folks that are really in the community every day and providing care, regardless of what the rules are or what's allowed or what the funding is, right? Like they continue to show up for their clients, their patients, their family, their community. And I just want to take this opportunity to say thank you to our frontline service workers.
Thank you for that. And thank you, everybody. And, you know, the last closing remarks are so important. I guess the one thing I would ask is that we continue to listen to people. People, you were mentioning earlier about how this didn't happen since COVID, that we were already in trouble before COVID. And I can tell you, having been around for a while now, that the messages that we're hearing from people about what they need haven't changed a lot. And what we really need to do is listen and continue to listen and also try and act on what people say they need. And that would be my final remarks. Thank you.
Thank you to the amazing panelists. A round of applause for them. Thank you so much. Thank you. And thank you for all what that you do at each and every day. So thank you so much. So in closing, I just want to say, please join us at our next TC Talks. The next one will be on building complete communities on May 6th from 6 p.m. to 8 p.m. at the 519. We will be inviting the chief planner, More Neighbors Toronto, and Heritage Architects to discuss more about planning and physical community buildings. And following that, we have our TC Talks again on June 10th from 6 to 8. At the Wellesley Community Center, we'll be discussing the important topic of tenant rights. For that talk, we will be inviting Rent Safe TO, Neighborhood Legal Services, and other community organizations that represent tenant advocacy. And don't miss our upcoming events, either on April 22nd, 23rd, and 24th, and 26th. Busy April. We have spring housing clinics at Wellesley Community Center. And on May 1st, 3rd, and 5th, we have spring housing clinics at Regent Park Community Center at the same room that we're in tonight. Other fun events we have in the community. We have our Easter egg hunt at Allen Gardens Children's Conservatory on Saturday, April 19th from 10:30 a.m. to 12:30 p.m. Then we will be moving the Easter Bunny to St. Lawrence North Market for a meet and greet from 1 p.m. to 2 p.m. And on Saturday, May 17th and Saturday, May 19th, we have our annual Environmental Day. So bring your homework and old documents for shredding. Bring any chemical waste like old paint, dead batteries, or broken electronics for recycling. Bring a bucket for a bag of gardening soil because we don't have a lot of compost that day. And it's not me. Again, thank you all for joining us tonight, and thank you to those joining us online. And of course, our contact information is here. My constituency office is right down the street at Dundas and Parliament at 329 Parliament Street. We're open Monday to Thursday from 10 to 4. And of course, if you're going to reach out to us, you can call us, you can email us. I always mention here that we do post on social media, but we do not respond to social media posts because that's where bad things happen. Anyways, have a wonderful evening and we'll see you next time. Thank you so much.